What is diagnosis? How about receipts? A very specific scenario. Hello. I'm Zafira Rose Johnson, and I am a dance movement therapist in training. Okay, let's get into it. I'm in Arizona. I'm in the US. Use the DSM-5. This is a very specific scenario. I'm someone who's using movement for therapeutic outcomes. That is already not usually what the Western world does or what is billed by insurance, okay? To create an effective treatment plan, rumor has it, not only do you need a diagnosis, but of course you need objectives and what types of interventions you're gonna use. Consider developmental stage, attachment, socialization, gender, cultural background, moral and emotional development. There's a lot of things that providers can do in order to give insurance the least amount of your business. I think that's the point. I'm not working for insurance. I'm not working for the government. Unless my next job is for the government, I am looking at what diagnosis is needed for my client to get insurance. Okay, so stay humble. This is a human being. Who gets diagnosed? Anyone! Anyone can get diagnosed. Do you think that something's wrong with you and you want to get treated within a medical institution? You can get diagnosed. Actually, you probably need to be diagnosed in order to be treated. But when you have a diagnosis, you are probably going to be more likely to get a treatment plan that actually helps you and is evidence-based. I currently don't think that a treatment for a specific ailment or disease without a diagnosis by an institutional provider is probably ethical, because they have to say why they are providing you with the care that they are. And that has to be backed up. I will say that a diagnosis implies that something is wrong. There are specific implications that we have normalized around diagnosis that I think are important to just be aware of. So it implies that the symptom carrier or provider thinks an intervention is necessary for a change to occur in order for these symptoms to lessen. Not anyone has access to the people who give diagnoses. So to me, this implies that not everyone has access to getting the treatment that they need. So when does someone get a diagnosis? Baby, kid, lesson when you're an adult. In Arizona, mental health providers must complete an initial behavioral health assessment for a patient within 7 calendar days of an initial referral or request for service. What does that mean? That means that I see you once, maybe twice, if I'm smart about it, right? Like I could do a Monday and then I have you on that Monday, so I've seen you twice. But I'm assuming maybe I've only seen you once, right, for an hour, and I am required to do an initial behavioral health assessment. So I will say that diagnosis involves tests and questions and really figuring out how we are conceptualizing the problem in a way where then I, within my moral framework and ethical framework, am able to do an initial assessment and be clear about what I think is going on in a way that is not jeopardizing your health outside of the therapy room. Where does it occur? Where do you get diagnosed? You get diagnosed where the people are that can diagnose you. Now this seems really obvious, but I'm just really hunkering down on who gets access to diagnosis and who gets access to treatment. Why do you get a diagnosis? To bill health insurance for medical or behavioral health services in Arizona, a formal diagnosis and a letter of medical necessity are almost always required. So insurance only covers treatments aimed at diagnosing or managing a recognized medical condition. In order for me to aid in someone's continual care, you do have to technically have a problem that needs that amount of care. So I'm not saying anything directly, but I hope that these viewers can understand the implications of what I'm saying. I think a diagnosis is very important, because if you don't have a diagnosis, I actually might be treating the wrong thing. I want the treatment to be effective, right? First priority is doing no harm, and so I'm going to be looking at evidence-based interventions in order to treat my client. How can you diagnose? If I were going to diagnose someone, I'm going to need to... What am I going to need to? I don't really know, because I'm in training. My introduction to the DSM-5 was when I was a kid, and I got diagnosed with depression when I was 12, right? So there was a diagnosis that happened there. I understand that it was necessary for me to get treatment that was covered by insurance at that time. Was it necessary to tell a 12-year-old that she was depressed and had depression at a very pivotal time in her identity formation? I'm not so sure about that. So the DSM-5 holds the codes that a provider needs in order to chart a diagnosis. When I go through all of the steps in diagnosing someone, I will at the end have a code that I put in their chart. So in conclusion, when it comes to diagnosis, usually there's the DSM-5 and there's other assessments that clinicians use. Dance movement therapists are going to use body-based assessments in tandem with these. We're not only going to use that verbal language data, but we're going to use body-based data as well. There are usually physical manifestations of psychological problems. And so this is, in my opinion, a more multifaceted approach to diagnosis.